Welcome to Wellness Tea Time with Dr. Rita. My name is Dr. Rita Sonko, a public health physician. I am the host of this show, and I aim to help you engage with different guests to understand more about mental health. Remember, Toliweka, you're not alone. It's very important for us to break the stigma and break the silence about mental health. Welcome to Wellness Tea Time with Dr. Rita. I'm so excited to have you, Angela.
I'm more excited. Nice to have me.
Yeah, thank you so much for coming.
It's a pleasure.
So for our viewers, please introduce yourself so they know who Angela is.
Okay, I'm called Angela Nsimbi. I'm a mental health activist. I'm an author, a journalist, and many things. Yeah. But why I'm here, it's mainly because of the mental health awareness campaign that I'm involved in. I love promoting mental health awareness and also the advocacy aspect from also a point of view of a lived experience. And of course, the platforms that I use books which I've written.
Yeah.
I also use a mental health program called the Heart to Heart Chat mental health program. And then there's another organization I co-founded with other people called My Story Initiative. Yeah. So I work in those different spaces. Of course, with partnerships.
And you're a journalist as well,
yes, right? I'm a journalist as well. So that is a bit of what I do or what I am about.
Now, thank you so much, Angela. I think using your expertise as a journalist to really bring awareness to this issue of mental health is really amazing. As you know, Toliweka is a campaign that we started and launched actually fairly recently. And the aim is to demystify and help people understand what is mental health. A lot of times when I talk to people, I ask them, what is mental health? What comes to mind? And they always say, oh, I think you're talking about mad people. And I'm like, oh my God, we have a lot of work to do, right?
And many people don't understand it. Because I've also talked to some policymakers who say, people have mental health. And they are saying mental health as though it's a disease. And they are not aware that it is about our well-being and also how productive we are as well. So they don't relate it to emotions and productivity of people. So that's the challenge.
Absolutely. We have a big job to do. So can you share a little bit about your personal journey? What inspired you to even get into this mental health advocacy and awareness? What's your journey been with mental health?
My journey started, I can say, when I had a breakdown in 2000, towards the late 2008, going into 2009. I just found myself in that place where I'm not sleeping enough. And I also, some of the symptoms, how it manifested was rapid speech. So I'll be honest, at the time I didn't understand what was happening.
Right.
I was a young mother. My fourth baby was only 9 months at the time. So I'll not lie, I didn't understand. So one thing led to another, and eventually I remember when I was in crisis, my husband brought a nurse to sedate me. And when I was sedated, it took me a while to sleep. Eventually, I slept. So when I did that, I saw how even around the care, I wasn't immediately taken to hospital.
Right.
So I remember eventually telling my husband, you know what, I think we need to check this out. And we see what is the issue. So cutting the long story short, I realized there was a gap on information. So because there was that gap and I was in a place where I felt, I think now I'm in that space where I can talk about it. Because I remember one of the people I worked with, because of using the sedatives, the psychotic meds, I started to gain quite a lot of weight. And I remember him telling me, hey, what's wrong with you, Angela? Are you competing with your sister? Because I had a sister who was bigger than I was. So I remember trying to to explain myself to him.
Yeah.
And I realized I can't explain myself to everybody because I wasn't yet in that place where I was comfortable to share yet. But I just said, I've been going through something and I'm taking medication and this is the side effect. I didn't explain the details. So after a while, I realized that it's important to speak up and go beyond even sharing my story and start also supporting other people. So it started from that aspect of a lived
work.
a lived experience. But then I said, time to share the story. Yeah. But when you have family, I also had to talk to my husband about it first. But he was okay with me sharing the story. And then obviously, as you go along, as you share the story, it expands because there are some things you're not comfortable to talk about in a certain point in time. Then later on, you're able to talk about them. So I realized people need to be comfortable to seek help. And if more of us spoke up, then people will no longer fear to even go for help.
Absolutely.
That's one of the reasons, how I got involved in that space.
Wow. Thank you. And I think that's a very nice segue to my next question around dealing with stigma. Because obviously with the limited understanding and lack of information, a lot of people have these fears about mental illness and they don't even understand it. Or like you say, they call the mental health the illness. And there's all of this confusion. What have you seen as the big issues that might be influencing this big stigma that we have around mental health? I mean, it's really a huge challenge. I'm sure you've experienced. But in your analysis, what are some of the issues?
Now, some of the issues also starts with the care. Even before you go to hospital, how is your family dealing?
Right.
Yeah, because also family, they are afraid. Because it's something not everybody totally understands. Because first of all, you're also behaving out of character.
Yeah.
And then two, because they don't understand it, of course, the first point of call, either someone will take you to a witch doctor or to a pastor. Thankfully, I was taken to a pastor.
Not a witch doctor.
Yes, and that pastor is Pastor Chazi.
Right.
Yeah, I was taken to him. I remember my husband holding the album. I'll use this as the demonstration. Our wedding album. When he's distraught and saying my wife is not well and all that. And I remember Pastor praying for me. And when he did, he actually informed my husband. He said, now take your wife to hospital after doing that. So when I say it starts from the care, I'm also giving an example, my first experience walking into the hospital for care. Because I remember the doctor was very intimidating. Telling me, get on that bed, otherwise we're going to have to force you down. Wow. And I was not aggressive. So I remember looking at that doctor and in my mind I'm thinking, I wish she knew I don't even have time to fight with her. I just got on the bed, she injected me. So when it came to those things, like talking to me, what's the problem and all that, I had already decided to shut her out. Wow. Because of her attitude. And what I said, I remember, and I said it intentionally. I told her, Jesus is Lord. Every question she asked, Jesus is Lord. Hey, she got tired. And then she said bye to me. And I told my husband, I don't want to go back to that doctor. Yes. Then the next doctor I went to for care, because he had students with him. So I guess I was some kind of object they were studying in that point in time. And so he would ask me, how did this start? And as I was talking to him, the student laughs. One of his students laughed. Then I asked the student, why are you laughing? And I was serious, why are you laughing? And then the doctor told her, no, don't laugh. Otherwise I'll have to send you out. Because they were actually not just a few. There were like at least 10 students. Yeah.
I'm sure like a medical round would be a number of students.
So now, that is the part of the stigma that I faced. And then the other part of the stigma was from a family, a sister of mine, who felt she needed to tell the public about my mental health before I was ready to talk about it.
Oh.
Yeah, because she told somebody who is a friend, not mine, a friend to a sister, another sister. And then she said, hey, Angela is sick, Angela this, Angela that. So the stigma is real. And of course, when it comes to the part of discrimination, that's also a deep thing.
Yeah.
Because somehow people never get to look at you the same. That is the fact. It's because even when you have anything sound and true, which you have to address, people tend to dismiss you. You have nothing to offer. That one, she's like that. As though it's an episode or something. Even when you have points to share. So you realize that there are certain situations where you have to really be calm. And I will relate to one particular situation. When I was taken to hospital, to Tabika.
Yeah.
I'll never forget that day, 26th January 2009.
Wow.
In the car, there was a policeman. There was a police letter which had been written that I'm a threat. Not safe to be around. And because I got in that car before any of them got into that car, the moment I read that letter, I just pocketed it. And I said, let's see how this thing is going to play out. Because I was thinking, this is not true.
Yeah.
And then a sister-in-law of mine was in the car. A brother-in-law of mine was in the car. Then my husband was driving to hospital. Because you'll wonder why the police letter, our Mental Health Act 2019, actually, that's how it works. For you to be admitted, you need a police letter.
Wow.
So I'm taken through, and I remember standing between two wards and standing under a mango tree. That time I was holding my 9-month-old baby. And as I stood under that tree, I just realized, this time I don't know what's the way out. I was looking at women in the fence, groping onto that fence, saliva drooling down. At my mind, I'm thinking, man, I'm not this bad. But I'm wondering, when you have been labeled, they say you are not that bad, they'll say, indeed, she's bad. You see? So the best thing I did was just stay there, held my baby, and I said, Jesus, now this is you and me. You have to save me out of this. So thankfully, what I remember about that incident, my sister-in-law came because she moved up and down to ensure I'm admitted. And she said, you know what? They've said they can't admit. Why? There's no doctor. It's a public holiday. So because they can't admit, then that means she can't stay.
Wow.
And then for me, I was thinking,
prayers answered.
Yes, I was so relieved. So the issue of stigma and discrimination is real. It's deep. And also, like I said, because of the care, even in the system, because now I talk to many people because of the program I'm running. I talk to many people who've also been in care. When you're considered aggressive, you're taken to what is a side room. That side room is a slab of cement, no toilet, no bathroom.
Wow.
Yes. And when you're taken in there, you're naked.
Oh my God.
Yes. So it
almost feels like a prisoner.
Exactly.
Yeah.
But when I have interacted with our doctors, they have said the reason they do it is to secure the patient, to make sure the patient is safe. But now if you want someone to be safe, they are naked. And if you are a woman, so if you're in that time of the month, what happens?
Exactly.
So those are the issues we are dealing with. And so obviously I make sure that I also partner with different people to talk about these issues and see how do we improve the situation on the ground. And that's why through the platform called the Keturah Mental Health Awards, that's why we use that platform to also partner with the Ministry of Health, the Mental Health Division particularly, and different partners, different stakeholders, so that we get the conversation out and see how do we improve things on the ground.
Yeah. And I think that's a very important issue around patient rights, client rights. Yeah.
Yeah.
So advocacy around these issues is clearly, I mean, the point that you're raising around that cold cement floor, maybe it's not so cold in Uganda, but hey, climate
It's
change
cold
is
at
real.
night.
Climate change is real, and the weather has changed, and
True.
you know, you now have this little room that you're put in. It almost feels like, you know, when you watch the movies and those isolation rooms where they put the most stubborn inmates, it almost sounds like that. And you're thinking, oh my goodness. So when you've considered the rights in the space of mental health, and you know, when it comes to the clients,
Yeah.
what are you finding to be the main challenges that we are facing in Uganda? You know, obviously we have limitations of resources and all of that, but there seems to be some basic human rights issues that seem to be emerging here.
There's a lot that is emerging. So what happens is, because I also interact with the hospital, Butavika Hospital, at least for those moments when they've participated in like a mental health camp, they avail information about the patient's charter so that the patient is also aware of their rights.
Right.
However, of course, more awareness needs to be created around this space so that also the patient is aware, what are my rights?
Right.
And then even as you know what your rights are, then also the people providing the care and whatever else the support also know, how do we ensure that we treat this person with dignity? Yeah, because that conversation, we need to continue to have that conversation because many people's rights have been violated. That's a fact. And New Vision actually had a 4-part series covering the allegations of what is happening in the hospital space. And those allegations, because the journalist was in there for 3 months. So the journalists also had so they were there for 3 months. So their account, their experience, what they saw, what they observed, that's what they wrote. And so this was done in 2023, January. The stories came out, 2023. So it is to show that we need dialogue because also someone who is like the service provider, a medical person, they will tell you, now you are left with a ward of several patients. I won't even go into numbers because Butabika on its own has 550 bed capacity. And then at any one time, they have over 1,500 patients at any one time. And what I'm saying is a bit old news. So now, if they have that kind of met patients, people who are in now, the peers who are out of the care, who will tell you, I've shared a bed before. And then you also look, this person is also a human being. What do they do? You see? So yes, resources are limited, but still, let's work with what we have. Let's get the dialogue out there so that we also treat people well. So dignity. With dignity, that's very important. The dignity part is very crucial and we can't sugarcoat that part.
Absolutely.
So the conversations, we have them in different spaces, but also empowering people who have lived experience, who are still using the services to also know and be self-advocates.
And say, this is that contribution
exactly.
To the
and they say, this is what we can handle. Let's change this, let's change that. Because it's all a partnership kind of thing.
Wow, sure. So many issues, so many issues.
So many issues.
So on the, of course, anyone going through a health challenge, and of course, definitely mental health challenge, needs support around them.
True.
What, in your experience, have been the highlights of positive support around you, maybe from friends, family, maybe work, that has been helpful? And on the other hand, what aspects of that haven't worked well that you would wish, would have been different?
Okay, now maybe I start with family because our celebrations this year, the theme is family-centered mental health care and support.
Right.
And I think family does a lot. And for me, family stood in the gap a lot. Because as a young mother at the time, I had already 4 children, and they were all, at that time, they were all under 10. Yeah. So now with children who are under 10, family had to come in. And I remember when I had to, because the first time I really didn't have to be admitted. I was an outpatient, but the second time I had a relapse, 2011, I had to be an inpatient. So at least in those situations, my family stepped in.
Yeah.
The children were well taken care of, and for that I'm very grateful. And I remember for a while, actually, my husband would go with me to hospital.
Yeah.
So it really took a while. We'd go together, even be in the queue with the children. If it was time to pick them up, he would go get the children, would remain in that queue with the children. So the support I got from family, I really got a lot of support.
Such a blessing. Hey?
That one I really thank God for, because he eventually started to let me go by myself when I was confident enough to handle it.
Yeah.
And then when it comes to the community, the support I got in community was also quite commendable, because it also, you have to first find out for yourself where is the help.
Yeah.
Because I remember there was an organization at the time called Heart Sounds Uganda. And that, it was the first peer-led, it still exists, first peer-led organization in this country, community-based organization. Yeah. And in that space, I found a sense of belonging. This is a space where no one judged you.
Yeah.
No one was harsh on you. And people understood the struggle. Yes, I found people at different levels of recovery, and that helped me. But how did I get to know them? My husband used to go for lunch hour fellowship at Christ the King. So he met one of the guys who was responsible for the public relations. And I remember that guy, I'll never forget him. He's called Jimmy. Me, I never used to go for the lunch hour. So he gives him a flyer, because we met in the queue at the doctor.
Right,
so he gives him the flyer. Here's the flyer. Of course, he didn't know who is the sick one, me or the... So he said, but this, it will help you, because it was movie night.
Right.
But now we would always have a conversation on mental health after that movie.
Wow, okay.
And so for me, that's the first time. I had never heard of anything like that. And I remember after that experience, my husband went with me. I was not going to go alone. After that experience, I decided, why don't I engage more with this community-based organization? I even got trainings as a peer counselor. So it was a very good support system, because it gave me hope, and I realized I still can make a difference.
Absolutely.
And that's what has helped me be where I am today.
Wow.
But of course, the other also in community is to be allowed to be involved.
Very important.
Very important. Because when you're involved in different activities, it gives you a sense of purpose.
Yeah.
And then you also have hope. Then you don't have time to throw a pity party. True. Yes. So in the church space, and eventually the journey of seeking my own healing at a deeper level beyond the medical model, that has really been my journey of reading the Bible, meditating on it, and speaking the word over myself. I always tell people, be your own prophet. So that, because sometimes we are in those places of the pain, emotional and mental pain, because of the pain in our past.
Yes.
Whether it's a childhood issue.
That generational pain and trauma.
Passed on. And then you realize that, you know what, I need that deep healing. I always tell the doctors, with all due respect, Dr. Rita, that medication doesn't deal with the root pain. I will sleep, but after that, what next? So,
that emotional pain is not easy to deal with, and it's not necessarily healed with drugs.
No.
Yeah, that's important.
And I was there telling my friend, whose name I will not mention, but she knows herself. I was telling her, and I was saying, you know, the day I went for my therapy, that therapy, the psychotherapy, And then I was talking to my therapist and she fell asleep.
What? She was exhausted.
She was exhausted.
Oh.
So when I looked at her when she's sleeping, I told myself, you know what, Angela? Now at this level, I need God's intervention.
Wow.
Because I realized that I'm also overburdening my therapist. And she was tired.
She was tired.
Yes, that day was a hard day.
That speaks to the conditions of work too of our
True.
mental health professionals.
True, they are also stretched.
Just a bit too much, going on there.
Yes.
Right. So I think as we conclude, what would you like to say to other people out there who might be struggling with mental health issues of their own, or they have a family member or a friend who is going through this thing, and you know what you know? You've been a patient yourself, but you're also an advocate now. You're helping a lot of people understand this. But there's a lot of people who have never spoken to anyone. They don't even know what they're dealing with.
True.
Or they're still experiencing a lot of the hiding away from stigma and all the other issues that go with that. What would you say to them?
What I would say, they should not be afraid to seek help. Yeah, because some people, when you tell them, oh, go get help, they hate that word, butabika. Some people, even though I'm giving them a doctor's contact, they'll tell me, where does the doctor work? Ask. If the doctor is in Butabika, they'll tell you, can't you get me another doctor?
Right.
Then you ask them, but this doctor will do the job. They say, no, we don't want that place, that name. So what I would tell people, not to be afraid to seek help. Because sometimes certain things might be mitigated, but just because you've gone even for a session of psychotherapy.
Yeah.
Maybe a peer support group, because we also do that in that space, the heart-to-heart space. So people need to understand that it's okay to get help.
Yeah.
They should not be afraid, but also family members should not label the people who are struggling.
Yeah.
They should support them. And just be kind. I always tell people, be kind.
Yeah.
And as I'm telling them to be kind, also I'm taking the opportunity to invite them for the Ketura Mental Health Awards.
Very important.
Yes. Because we celebrate them every year, October 10th. And that space, first we're going to have a self-assessment mental health tool by yours truly, Toli Weka.
Yes.
Dr. Rita.
Yeah.
So then we also have the therapy table.
Yeah.
So people will have a therapy table so that they know how do we get further help.
Yeah.
And while we are there, we shall be celebrating the people who are making impact in the different spaces.
Yeah.
Different categories, but specifically mental health, because we want to raise awareness.
Yeah.
Yes, we have a nice time and all that, but people should know there is help. Let them be part of such activities. And it is, like I said, right, October 10th?
October 10th. And that's
Protea Hotel.
Hotel, yeah.
Tickets are 150,000.
Yeah, and this is in Kampala.
It's in Kampala, Kololo.
Kololo.
Yes.
Right. Fantastic.
Yeah.
Thank you so much for sharing
Thank you for having me.
Can you tell us a little bit about your book? I know you have many books. Tell us about just the one and where we should get it.
Okay, because this one is somewhere else. Okay, I'll talk about this particular one. This one is Breaking Free.
Oh, wow.
And the subtitle, though it's long, I say, I'm Not Bipolar, A Journey of Hope, Healing and Restoration.
Wow.
So about this particular book, it's really my journey, an account of my recovery journey.
Wow.
What I have done to help support other people. What I have done in terms of getting my healing.
Yeah.
But also to show people that the journey of healing is continuous. But what's important, keep impacting. Because sometimes when actually you think you are down, it's just your platform to get up.
Exactly.
Yes. So this is for people who don't understand bipolar. Doctor, there are people who have ever asked me, but what is bipolar? You tell us.
Of course.
Of course, doctor, if I've not said the right thing, but me, I'm going to keep it basic.
Yeah.
Now, bipolar, it is the highs when you're facing mania, which excitement, which might be a little longer than maybe 2 weeks, and it's disruptive. Then when you are down, your depressive episodes, that is depression for longer than probably more than 2 weeks. That's the mix, bipolar, the lows, the highs.
The lows and the highs.
The lows and the highs, And so
I don't think I could explain it better.
I had to do the disclaimer. You might have a better explanation.
Well, the lived experience is always useful to help people, hear things from your perspective as well, as someone who has gone through something. But thank you so much for coming to Wellness
It's a
Tea Time
pleasure.
and enjoying a moment with me. We had a nice cup of tea, by the way, before this. Of course, now we're having
we are refreshing.
But it's been really fantastic to have you.
Thank you
so much.
me.
And for our audience, the more you learn, the more you're going to be able to help yourself as well as help other people. So keep listening, keep watching, and look out for Angela and Nsimbi. She's doing a lot of advocacy work. Thank you, Angela.
Thank you, Dr. Rita. Lovely being with you.